All right, this video is for the dysfunction syndrome of the mechanical diagnosis and therapy, aka McKenzie protocol. This is out of their module or part A handbook. I took part A back in January of 2017. What I have written next to it for the dysfunctional syndrome, I just have a little note when I took the course. The little note was just for myself, and looking back, it's very important. It says pain with movement, but not worse afterwards. So, dysfunctional syndrome is caused, again, I'm reading directly out of the handbook. If you'd like to read more, you can go to their textbook. The pain is, pain from the dysfunction syndrome is caused by mechanical deformation of structurally impaired soft tissues. So, structurally impaired soft tissues. This is where we think of scar tissue and such. The abnormal tissue may be the product of previous trauma, inflammatory, or degenerative processes. I will say that one more time. The abnormal tissue may be the product of previous trauma, inflammatory, or degenerative process. These events cause contraction, scarring, adherence, adaptive shortening, or imperfect repair. Very, very key features of dysfunction syndrome. Pain is felt when the abnormal tissue is moved. Tissue doesn't work very well. It's not quite right. It's dysfunctional. It hurts to move it. Ow. Articular or contractile structures can be affected. Articular dysfunction, contractile dysfunction. Those are two different pieces of this. But that's kind of branching from the same one big syndrome of dysfunction. Articular or contractile structures can be affected. The former is the most common, or is more common in the spine, which is what we're going to read about soon. When affecting articular structures, it is characterized by a painful restriction of end range movement. Articular dysfunction, pain with end range movement. That's key as well. Pattern in the history. This is what we're listening for when we're taking the history. Some sort of history of trauma, some sort of a derangement. They had a history of derangement. Watch the last video on derangement. Maybe there's years of poor posture, degenerative changes as well, right? So they had something in their past health that said, I've had this before, kind of comes and goes. I've had histories of more than one derangement, a lateral shift of some sort. Now we're dealing with the dysfunctional health of that tissue. So history of trauma, derangement, or years of posture, degenerative change, that's not good. Typically a derangement has to be present for at least 8 to 12 weeks. Someone shows up to your office or to your clinic or to your wherever and says, mom, dad, cousin, sister, nephew, whatever, and they just started having pain last week. This is not a dysfunction. Dysfunction needs to be present for at least 8 to 12 weeks. Pain is always accept. I love that. Pain is always local with dysfunction. Accepted here in nerve root. So we think ANR, dysfunction. ANR stands for adherent nerve root. Dysfunctional healing tissue, adherent nerve root. That's not local. All of the dysfunctions are local, so it hurts here. Pain is always intermittent and produced only when loading structurally impaired tissue. If I have a dysfunction in my shoulder, part of the McKenzie protocol, they want to make sure you're ruling out the spine. If I have a dysfunctional shoulder injury, history of rotator cuff, if I have dysfunction there, and I retraction extension on the neck, forward flexion, if I have those, and those are full and they don't hurt, and my shoulder still hurts and nothing changed, That is a dysfunctional shoulder that's not coming from the neck. It only hurts when loading structurally impaired tissues. Ow, my shoulder. Shoulder's fine. Not coming from my neck, only coming from my shoulder. Symptoms cease, so symptoms stop when the loading is ended and the pain does not stick around. Ow, that hurts. Doesn't hurt anymore. Ow, that hurts. Doesn't hurt anymore. Those are history. That's what we're listening for, okay? With the examination, the mechanical examination, we're looking for a consistent direction and amount of movement to produce the pain. So we're looking for, in the example of a shoulder, right, we're looking for some sort of a dysfunction in the shoulder as this example. Consistent direction and amount of movement produces pain. We're not thinking directional preference, derangement, those go together. Dysfunction, movement, loading that dysfunctional tissue. Sometimes with a dysfunction, we have a restricted movement in one or more planes of motion. The shoulder is a key example. Extension and internal rotation, a lot of times, they'll do adduction as well. And then appropriate repeated movement will produce symptoms which do not remain worse. That is the dysfunction syndrome. Only the characteristics, history and examination only. Consistent direction, amount of movement, that is going to reproduce the pain on the exam. Restricted movement in one or more planes of motion, and the appropriate repeated movement will produce no worse. Produce no worse. Produce no worse. That's a dysfunction.